My eating disorder feels to me to have an almost physical presence in my mind, a relentless voice that constantly nags, criticises and tries to control me. Since I first sought help for my problems with eating, my experiences of the community-based treatment I was offered have been very positive.
This is Jane's story. Jane has been getting help for an eating disorder from a new service launched by NHS North Yorkshire and York in 2007. The service supports people in the community so they can remain with family or friends, helping to manage and overcome their problems.
Admission to an eating disorder unit has always been an option I've wanted to avoid. I feel that being able to stay in the community allows me to draw on the invaluable support of my family, and keeping busy helps distract me from my anxiety.
Providing a link for the families and carers of people with an eating disorder is an important part of this new service. Lynn Webb-Thoris, who manages the Carers Centre in Northallerton, explains how the new service has helped families.
Basically, we're trying to raise awareness in a joint project with the PCT and ourselves, and it's the first of its type in the North Yorkshire area. We've been advertising, raising awareness, trying to reach people who are caring for people with an eating disorder, because it tends to remain a hidden family situation, and we're trying to get people to recognise that there may be a problem and that there is help out there from ourselves and from other health professionals.
Well, patients with severe eating disorders were held and treated within the community mental health teams working in conjunction with psychology. But once patients became risky, there was a need to refer them to the specialist eating disorder units. And the intensive inpatient care provided by those units meant that integration with the community care was really difficult. The gap between the two services was very great. Part of the aim of this service is to make sure that when people are admitted to hospital, they are in a state to be able to use that admission well and really make lasting change in order to improve the relapse rates afterwards.
The majority of people that you're working with, it's the last thing they want is an inpatient admission. And I think that's understandable. Lots of people have difficulties around control. And also I think that people are at different levels in acknowledging their difficulties. People will be at different stages in their motivation for change, in their ability to change, and they'll have had different experiences of services before. So I think everybody's very different in terms of where they're at when they come along, and what we're able to do is design a care package that reflects that, I think.
Although this voice remains very strong, the support I'm receiving from both the team and my family is allowing me to begin to challenge it. I have always been very grateful for the opportunity the team has offered me to stay in the community, as I realise I would not have had this option without this new service. My treatment plan makes me feel comfortable and secure, as it takes my wishes into account and accepts my needs as an individual. Rather than being alone in the battle, I now feel I have a little army helping me to fight.